if someone's out there and saying, hey, listen, I use lipstick as a woman. I am around these things. I eat food, in general that may have, I like fish. How can one test for heavy metals, and is it truly reliable?
Okay, so there's three different realms that you should do some type of testing for. I'll kind of go from, in my opinion, not knocking any of them, but from least accurate to most. So the least accurate is probably hair sampling, and probably the less commonly used. The reason being your follicle doesn't always express the heavy metals that are in your body, just because metals tend to stay in bone and tissue. So we don't really see that as commonly. The second best is blood. Blood has been used probably since, like the 1940s or 50s, and definitely more common in terms of lead testing. We still do that for pregnant women, for kids, and for adults. However, again, we call heavy metals lipophilic. So they like to stay in tissue. So if you're taking a blood sample, it may not be accurately expressed in the blood. So in my opinion, the gold standard is urine. And the best way to practice that is giving a provoking agent before you do a urine test. What does that mean? That just means giving, in my opinion, IV, some type of IV chelator. Why do we do that before the urine test? We do that before the urine test because when you're giving an IV chelator, it changes that metal. It binds to that metal and makes it what we call water soluble. So that means it will be flushed out in the urine, the kidneys and the bladder. So when you're taking that test, whether it be hour 24, whatever you're doing, it will be a little bit more accurately expressed. Then you can say, okay, whoa, holy moly, Casper, you got really high levels of lead and mercury. And then you kind of go from there in terms of treatment.